back with the Rocket Right Show. I'm Dr. Kay Solar in the house with, another doctor, Dr. William Varnado, because this is our medical segment brought to you by Mary Bird Perkins. And thank you so much for taking time and visiting with us today.
Absolutely. It's a busy time, but thank you for having us. We always love coming in.
I appreciate it. And, I'm wearing my pink jacket.
I see that.
And you got some pink on your tie. Fuchsia. Hot. We're both kind of hot pink here.
My wife dresses me about 90% of the time, so blame her if it's not as pink as it needs to be.
I think it's actually good. I like my pinks really hot.
Okay, good.
So you did good. And so we're going to see a lot of pink this month because October is Breast Cancer Awareness Month. And I'm so glad to have you today because we're really kicking it off because this show comes out the first weekend of the month so people can think about it all month long and get their head wrapped around what they need to be doing for early detection. Let's talk about that.
Yeah, absolutely. So thank you for showing enthusiasm and awareness for this. In all the cancers and diseases we treat, ideally you try to find things early, and that offers more options for treatment, more options for a cure. Unfortunately, for a lot of tumors and cancers, we don't have that option, but breast cancer, we've been fortunate enough for years now to have mammograms. And so they're important in the fact that they allow us to find things earlier, thus allowing more treatment options and ultimately thus allowing more cures. And so I think it's important for all women to at least be aware of the options available to them in their city.
Yes. And let's talk about screening because I know sometimes it's been confusing. They'll change the recommendation or this will say this or that. So go for it. What do you say now?
And there are several different guidelines, but luckily in the recent history they've gotten things more streamlined. I think by far the most important still remains that women who are the age of 40 and above should have yearly mammograms along with a yearly clinical breast exam. A clinical breast exam being an exam done by a trained physician or a medical provider. But some of the things that we unfortunately see out in the community are younger women who are diagnosed with breast cancers. And so we like to at least make them aware that starting as early as age 20, having a clinical breast exam or, again, an exam given by a provider about every 3 years is recommended. And also self-breast exams still remain somewhat controversial as far as giving your own self-exam. So creating anxiety and do things improper is still somewhat debated.
But, I think that if a woman is going to her gynecologist, primary care provider, part of that visit when they start early on is teaching them what to look for so that they do recognize something that's different and they don't freak out about something that is normal tissue. And that I can't tell you how many women have found their own lumps. So if they weren't checking, they might have not come in, especially that young group, something is different. And any physician would say, you know what, I'd much rather you come in and have me check that out than to ignore that and think it's nothing.
Absolutely. I think that's
regardless of the age.
Incredibly important. So two things you said there I think that are really important. One is the relationship between these young women and their gynecologist, and that the gynecologists, especially associated here in Baton Rouge, do a great job of awareness and education, and I feel are very open to their patients about talking about any changes that may be going on in a young woman's breast that they're worried about. And two is absolutely, if there's any concern about something they feel, something they see in their breast, they should immediately ask their gynecologist. And I think that's usually the quickest avenue to get to a doctor that they have. And that a lot of women associate that with a bump or a mass or something like that. But other things such as skin changes or pain or discharge that seems abnormal to them, then they should get it evaluated. And it's never wrong to ask.
Absolutely.
And the worst that can happen is they say, this is completely normal, this is not worrisome.
Right.
And then everyone sleeps a little better at night.
Absolutely, for sure. And so when we're talking about the screening as the mammograms, some people go, well, how do I get that done? Well, first of all, if they go to their gynecologist, they're going to be on top of whether they need to get scheduled and if they're due for that. But you may have some other information as far as screenings that Mary Bird is offering, especially this month.
Yeah, and so last year was a fantastic year as far as the health community goes in Baton Rouge for screening women for breast cancer. So again, if there's a concern or you have questions about screening, you can always direct your questions to your primary care, your gynecologist. But if you're just concerned that you qualify, you want to get screened, between Mary Bird Perkins and Women's Hospital, they provide free breast cancer screenings to women who qualify. Those are done sometimes at the facility on campus at Women's Hospital, but also there are mobile units that go all throughout really the South Louisiana, from Baton Rouge to Livingston Parish to as far as Houma and Thibodaux, and help people get screening closer to them so they don't always have to travel. And those are provided free of charge. And in the unfortunate situation that something is found, the follow-up to that is directed very smoothly into where you need to be. So not only do they provide the screening, if something were to be abnormal and need follow-up, they also provide a very direct path on where you need to go and plugging you into a system. So it's not just the screen, it's a pathway into the treatment you need to be followed up with.
Absolutely. So anyone can get this done. There's like no excuse for not checking it out.
Exactly. As long as you meet the screening guidelines.
As long as you meet the guidelines.
Exactly.
And we're going to talk about, some risk factors now, because I can't tell you, so many women would come in and go, but do I really need that mammogram, Dr. Stellar, because, I don't have any family history. So let's go over those risk factors.
And those are reasonable questions, So we kind of break up the risk factors for breast cancer into things that the patient can do to prevent it and things that the patient frankly can't do anything about. So the things that unfortunately we can't do anything about are family history, age. Now, I was told you were 35, so age hasn't become an issue for you, right?
Not at all.
That's what I thought.
Thank you.
But, you can't change your age. You can't change your family history. And so those things are that you have an inherited risk factor. So it's important to know your family history, but not only for breast cancer. I think it's important for women to know all of the cancer history in their family. And that includes ovarian cancer, men with prostate cancer that are in the family.
Because some of those do increase that risk for breast cancer, and they don't put that 2 and 2 together, but your doctor will for you.
Yeah, and so not just breast cancer, but any family history of cancer. And then there are what we call the modifiable risk factors. And in general, and I want to make a plug here, not just for breast cancer, but for pretty much all cancers. In general, living a healthier lifestyle has shown great prevention in preventing cancers. So this is regular exercise, having a good relationship with your primary care physician, not being obese. These things all prevent the vast majority of cancers. And so in general, living a healthier lifestyle and staying in close contact with your physician and keeping up with screenings is the best thing we can advise for women.
Absolutely. And we need to do a whole nother show talking about exactly what all those healthy lifestyle things are.
Yes.
So I'll have to have you come back and chat with that. Now, you mentioned some of the signs or symptoms that women should be alert to. Just kind of run down those and knock those off a little bit.
And there are some specific things that we educate women on, but what I'm going to make clear is that if you have a concern about a change in your breast, it's never wrong to ask. And so anything that's concerning to you, don't feel ashamed to bring that up. Now, the things that we specifically educate on are, one is any mass or bump that you can feel certainly needs to be evaluated. Any enlargement that you find unusual in one of your breasts, certainly have that evaluated. The ones that we often see that get neglected a little bit are skin changes and pain. And that it's not uncommon that young, busy professionals, young, busy moms have some pain in one of their breasts, and life is busy, and they try and muscle through that and deal with it. But please have that evaluated. So lumps or bumps, skin changes, pain, or discharge from the nipple are all very important to at least have evaluated.
And if somebody is diagnosed, let's talk about the different areas, including the Breast and GYN Cancer Pavilion, where folks can go and get that treated. And I know Mary Bird has always been about having that complete, comprehensive care, once somebody is diagnosed.
So the Cancer Pavilion at Women's Hospital is, first of all, it's a beautiful building. I don't know if you've driven by it or seen it, but it's a stunning building in itself. It's a large glass atrium. But what has happened there over the past 5 years has been really incredible, and that space is built out specifically for women-related cancers, and so that includes breast cancer and some of our gynecologic cancers. But what it provides is a way to have all your care done in one building, that you're familiar with the staff, familiar with the parking, familiar with everything that goes on. And so what included there is a great surgical group that is very highly trained in breast cancer, medical oncology that provides medicines, chemotherapy, radiation oncologist that specialize in breast cancer, also plastic surgery for reconstruction for women who have surgeries, and maybe most important, the best support staff maybe I've ever seen. And that the people who meet you at the door, to as far as people who guide you through the building, for as far as people who keep track of you during treatment, an incredible support staff there at Women's Hospital. So it really does have everything you need as far regards to breast cancer.
Yes, and I know y'all have had a lot of big news coming out with other partnerships, and I know that we're not going to have time to even talk about all that. So we definitely are going to have you come back and
Absolutely.
Chat about that, because a lot of exciting things to help patients in our community as far as screening and once they're diagnosed with cancer to have fantastic care, just always adding to that. And so I think if folks want more information about what we've talked today, the best thing is marybird.org.
Yeah,
right?
marybird.org. And important, again, breast cancer awareness screening, 225-215-1234. We'll plug you right into a screening program and let you know where to be.
All right, thank you so much. We've been talking with Dr. William Varnado with Mary Bird Perkins. Appreciate you joining us.
Absolutely. Thank you for having us back, and we're happy to come back anytime.
Well, we'll definitely do that because we've got lots to talk about this month. All right. And up next, we're going to be talking about one of my favorite spots to dine, Beau Soleil Coastal, and some of the new things on the menu. So stay put.